Hello, everyone there. I'm Dr. Sakhuja, one of the consultant psychiatrists in Kumtaf Health Board. And this video is just to briefly give you an overview of what the brain looks like and what are the implications of brain injury other than the trauma, specifically the alcohol-related brain injury. Alcohol Concern, University of South Wales, and us have been working on the alcohol related brain damage for a few years now, and they've kindly asked me to do this video to share my experiences with all of you. So let's start off with very briefly on the basic anatomy of the brain in simple lay terms. So if you look at this, I have a little model which tells us how the brain looks like. So that's the front of the brain, the middle and the back. The back is what I'm holding the brain from, and if you look at the bottom, that's the brain stem that further continues down and becomes our spinal cord. If we look at the inside, or just half of the brain, that is how it looks like, and I can explain to you as we go along what could possibly happen in various parts of the brain with different kinds of trauma. Alcohol related brain damage is a term that we use which covers an umbrella of syndromes such as the Korsakoff's syndrome, where there is a problem with the memory apparatus of the individual. And if we look at the memory apparatus deep within the brain, around this area, there are certain parts of the brain which are responsible for us to hold our memories from the past and learn new information. And in the Wernicke-Korsakoff's, the pathology lies in those parts of the brain where they get damaged, which means that the memories that we have held from the past are not as accurate and become deranged. Equally, long-term use of alcohol can cause problems in the front of the brain, which we commonly call as the frontal lobe. And the frontal lobe is actually very, very important for a number of things, such as our attention, our concentration, our planning, organizing, working memory. So it functions in a number of ways, and alcohol can cause a problem with the frontal lobes itself, and that can then lead to cognitive problems with attention, concentration, and as I said, planning and organization. Similarly, other parts of the brain do get affected by alcohol as well, and one of the parts is the cerebellum, which is the back of the brain, and that is responsible for us to keep our balance whilst walking and while standing, and all sorts of balance that is important in day-to-day functioning. If long-term alcohol is a problem, and if it does affect the cerebellum, that is when we start seeing people with problems with balancing, and their gait, that is how they walk, can be changed. What is key to understanding and doing something about the alcohol related brain damage is the importance of being able to tease the causes of the brain injury apart. So when we go and see people with brain injuries, it becomes very, very important to do an accurate assessment and a detailed assessment of their cognitive functions and sift through what could possibly be the causes of the brain not functioning as well, and determine whether this is traumatic, whether it is alcohol related, whether it is a degenerative condition. I need to be able to differentiate between whether someone has a static brain damage which is not progressing, or versus the brain functioning is declining as a result of a degenerating condition such as a dementia. And we often come across uh, instances where any brain dysfunction within the context of alcohol is just termed as alcohol related brain damage, which then can cause people to miss out a degenerating condition such as a dementia, or equally a degenerative condition can sometimes be confused with the alcohol related static brain damage. And the only way to figure those out would be for us to be able to serially manage and assess how the brain functionings are happening, what the neuroimaging tells us, what the electrical activity of the brain tells us. So, a combination of clinical assessments, neuroimaging, uh, neurophysiology uh, tell us what kind of brain injuries we are dealing with.